This is Liz from Social Work Exam Strategies, and today we're going to talk about understanding ASWB licensing exam questions. The basics. Every ASWB question uses a 3 or 4 option multiple choice format with these parts. Questions them, the main body of the question that poses a problem to be answered. Options, the possible answers. So you're going to have a key, which is a correct answer, and then you're going to have distractors, which are the incorrect answers. So let's look at the sample question. Question stem is your question. What is the capital of California? And then you have your distractors. You have A, B, C as distractors. And then you have the correct answer, which is D, Sacramento. So this is the format of the exam. You're going to have a question, distractors, and the answer. Qualifiers. Capitalize and bolded words in the stem. Provide important information to test takers. Pay close attention to qualifiers like best, first, next, and most. So let's look at a sample question. A clinical social worker meets with a 20-year-old client in a domestic violence shelter. The client tells the social worker that she has decided to return home to an abusive husband. What should the social worker do first? So we have a qualifier here. This is the first question. Let's read our answer options. A, help the client develop a safety plan. B, refer the client to a support group. Or C, encourage the client to remain in the shelter for her safety. So our client is a 20-year-old client that's in a shelter. And the problem is that she tells the social worker that she wants to return home to an abusive husband. So what's the first thing I'm going to do to solve this problem? I'll give you guys 30 seconds to answer this question. Take your time. The correct answer is A, help the client develop a safety plan. A addresses my immediate problem, and my immediate problem is that my client wants to return home to an abusive husband, which means she's going to be in an unsafe situation. That's my immediate problem, and that's a problem I need to solve. If you look at B, refer the client to a support group, that's not going to solve my immediate problem. C, encourage the client to remain in the shelter for her own safety. We don't tell clients what to do, so C would not be my answer. A is the correct answer. In the exam, you're going to have 2 kinds of questions. Let's look at number 1. Stems have either a direct question or incomplete statement. Second type of questions. Stems that contain a short scenario or a situation that leads to the question. Now let's look at some examples. Example, but incomplete question. Alcohol is a. This is an example of incomplete questions. I'll give you guys a few seconds to answer this question. The correct answer is B. So this is an example of an incomplete question. You're going to encounter these in the exam. Now let's look at examples of direct questions. What drug is classified as a depressant? I'll give you guys a few seconds to answer this question. The correct answer is C, alcohol. So this is an example of a direct question. Example of short story / situation questions. A social worker meets with a family experiencing stress due to one member being diagnosed with terminal cancer. What should the social worker do first? Now let's look at our examples. Begin family therapy, assess the family needs, refer for financial resources. I'll give you guys a few seconds to answer this question. So in this question, we have a qualifier, which is the first question. And my client is this family that needs support. They just found out a member was diagnosed with terminal cancer. That's my problem. And how am I going to solve this problem? Begin family therapy. That's not going to solve the immediate issue at hand. So A is not my answer. Refer for financial resources. There's no indication this family needs financial resources. So that wouldn't be my answer. I need to assess the family's needs. They're going through a difficult time, and they just found out someone was diagnosed with cancer, so I need to assess their needs. Cognitive levels. Exam questions may require test takers to use different levels of cognition. You're going to have 3 types of questions in the exam: recall, application, and reasoning. Recall questions. This is a simple remembering something. For example, information you learned in school, from a seminar, or in a textbook. Application questions. This means using what you have learned in a particular situation. Reasoning. This involves sorting through what you have learned along with considering the situation and other relevant information. So these are the 3 types of questions you're going to have on the exam. Example of a recall question. The termination process is most often associated with A, evaluating goals and accomplishments, B, implementing an action plan, or C, setting therapy limits. I'll give you guys a few seconds to answer this question. The correct answer is A, evaluating goals and accomplishments. In order to answer this question, you need to be familiar with termination process. Let's look at another example of a recall question. What part of social work helping process is most important in developing a therapeutic relationship? A, creating goals, B, intervention planning, C, establishing rapport. I'll give you guys a few seconds to answer this question. The correct answer is C, establishing rapport. In order to be able to answer this question, you need to be familiar with the social work helping process. Examples of application questions. So with application questions, you need to apply your own knowledge to a specific scenario. Now let's read this question. A student family is referred to a school social worker because the student has been disruptive in the classroom. During the intake session, the parents inform the social worker they are preoccupied with finding employment and meeting their basic needs. In this situation, what should the social worker do next? So we have a qualifier. This is the next question. Let's read our answer options. Tell the parents that the student needs to behave better at school. B, arrange an assessment with the student. C, assess needs related to the issues affecting the family unit. Or D, help the student talk to the parents about the reasons for their behavior. I'll give you guys a few seconds to answer this question. The correct answer is C, assess needs related to the issue affecting the family unit. If you look at the question, the client is the family, and the family is going through a difficult time. And it's the qualifying word is a next. So what's the next thing I'm going to do to help this client member? With application questions, you want to apply your own knowledge to a specific scenario. And in this scenario, I need to assess the needs related to the issues affecting the family unit because I'm addressing the entire family. A wouldn't be my answer. Tell the parents that the student needs to behave better at school. As social workers, we don't tell people what to do. And A is not going to solve my immediate problem with the family. If I go with B, arrange an assessment with the student, this question is about the family unit, not my student. So B is not my answer. Then we have D, help the student talk to the parents about the reason for their behavior. Again, my main problem here is a family unit. I need to address that family unit. So C would be my answer. Let's look at another application question. A social worker facilitates a treatment group for gang members for a court mandated to attend. In the second session, a group member brags to the others about the vandalism he committed in the neighborhood. In this situation, what should the social worker do first? A, report the client's behavior to the court. B, confront the client about the vandalism. Or C, encourage the client to talk about possible motivations for the behavior. I'll give you guys a few seconds to answer this question. So the correct answer is C. And let's see why C is the answer. So if you look at the question here, my client is the group member that just disclosed certain information to me. That's my problem. This member is bragging about vandalizing a neighborhood, and the qualifying is a first. So what's the first thing I'm going to do to solve my problem, my immediate problem? This client just disclosed certain information to me. How do I solve that problem? Report the client's behavior to the court. Well, I'm not going to do A first. I might do that at some point. Remember, you're going to do A, B, C at some point, but the question is asking, what are you going to do first? A is not my answer because A does not address my client, and my client just disclosed certain information in a group setting. I need to address that immediate problem. So A is not my answer. Then we have B, confront the client about the vandalism. We don't confront clients in a group setting, so C would not be my answer. The only answer option that addresses my client and the immediate problem is C. C is my answer. Example of reasoning questions. Remember, when it comes to reasoning questions, you want to sort through the information that you have learned, along with considering the situation and other relevant information. So I'm going to give you guys a few seconds to read this question, take your time, and read all answer options. Example of reasoning questions. So remember, when it comes to reasoning questions, you want to sort through the information that you have learned, along with considering the situation, other relevant information. As you can see in this question, there's a lot of information here. So let's break it down together. The correct answer is B for this question, potential dangers to the family. If you look at this question here, we have a 40-year-old patient, and he's about to be discharged. The patient has a mental illness, also has a history of assaultive behaviors and substance use disorder. So if you look at the history of this patient, he's a high-risk patient for discharge. So that's an indicator here. Now let's keep reading. The patient's parents want the patient to move into their home. So the client is high risk, he's a safety concern. And if he moves into the parent's home, the parent's at risk as well. So we have a lot of safety concerns here. Now let's look at the last sentence. What factors should the social worker evaluate first? So what's the first thing I'm going to do to solve my immediate problem? And my immediate problem is the safety concerns, not just for the patient, but for the parents as well. So let's look at our answer options. History of medical compliancy. There's no indication in the STEM that there's an issue with medical compliancy. So A is not my answer. And then we have C and D. C and D are not my answers because they don't address the potential danger for the family, right? The client is at risk, he's a safety concern, and also my family's a safety concern. So my main focus in this question should be that safety concern. And how do I address the safety concern within the family unit? And the only one that addresses the family unit and my safety concern is B. So B is my answer. Now let's look at another example. A school social worker answers a call from a parent asking for help with their teenager's behavior. The parent tells the social worker that the teenager is frequently defiant and aggressive towards a younger sibling and family pets. What is the social worker's most appropriate response to the parent's request? Let's read our answer options. A, suggest new discipline strategies for the parent to use. B, recommend the teenager receive a mental health assessment. Or C, explain that the teenager's behaviors are normal for this age. D, consult with a psychiatrist for a medical evaluation. Take your time. I'll give you guys a few seconds to answer this question. The correct answer is B, recommend the teenager receive mental health assessment. So let's see why the other answer options are not our answers. Let's go with D, consult with a psychiatrist for medication evaluation. There's no indication in the STEM that this teenager needs medication. So D would not be my answer. Explain that the teenager's behaviors are normal for this age. This answer is incorrect because the behaviors of this teenager are not normal, right? Frequently defiant and aggressive towards younger siblings and pets, that's not normal behavior for a teenager. So that's not my answer. Suggest new discipline strategies for the parents to use. I'm not going to do A because A doesn't address my immediate problem. And my immediate problem is that this teenager is being defiant, aggressive towards siblings and family pets. That doesn't really address my immediate problem. And if you look at the qualifier word most, if you look at the last sentence, it's asking, what is the social worker's most appropriate response to the parent's request? So I need to respond to this parent's request, right? And the request is about their concern with their teenager. So I need to address that. So B is my answer. Thank you for your time, and I hope you found this video helpful. If you like our video, give us a like and subscribe to our channel so you can be notified when we post new content. Please post a review in the comment section. And please spread a word of our community of social workers helping social workers. If you're looking for study material, visit our website to register for our live workshops, study guide, individual tutoring, and our social work exam prep program. Thank you all, and I wish you guys all the best of luck. Take care. Bye-bye.